Today I'd like to talk with you about patient and family-centered care at Northeast Rehab Hospital and why it is important to us for our patients in our culture of caring. Patient and family-centered care is an innovative approach to the delivery of health care that is based in partnerships amongst our patients, families, staff, and physicians. Patients define their family and how they will participate in care and decision-making. The successful implementation of patient and family-centered care within our organization requires a collaborative partnership with our patients and family. With this in mind, our patients and families must be viewed as important members of the healthcare team. Our patients want to be taken seriously and respected as partners in their care. They want to participate in their decision-making, and they want to be supported physically as well as emotionally. We must challenge our healthcare system and ourselves to improve patient care by considering the experience through the eyes of our patients. At Northeast Rehab Hospital, the dedication and compassion of our staff demonstrates that we are committed to building a culture that supports our patients and families. We support their access to loved ones at a time when they are most scared and most vulnerable. We believe that access to a strong support system is the key ingredient to healing.
The thing that made the biggest difference to me about Northeast Rehab over other places is the way, from the time we were introduced to the facility and the staff and the capabilities, was the interest in the individual, which was my mom. Every staff nurse came in, they took the bio of my mom and the history, the medical history, and we laminated it and we put it up on the wall so they knew how to pronounce her name properly, things she liked, things she didn't like, a little bit about her as an individual, not just a warm body who had a stroke. It was it was great.
Dignity and respect is one of the foundations of patient and family-centered care that builds upon the other concepts. This is the beginning of how we deliver patient and family-centered care. It establishes trust with the patient and family and allows us to work collaboratively. Putting yourself in the shoes of patients and families is one way in which we begin to recognize that person as an individual. Imagine what it would be like for you as a family member or a patient. How would you feel when you're confronted with a disability or a life-changing illness? Would you be worried? Would you be concerned? Would you be sad? These are the types of emotions that various patients and families feel as they're trying to cope with a stressful situation. So in other words, it means caring for the whole person and again, recognizing and respecting their choices and values and preferences. And some of the ways in which we do that, we make sure that we introduce ourselves and explain our role to patients. We greet them in a warm and welcoming way by making eye contact and smiling. We respect their privacy by ensuring privacy, by pulling curtains to do that. We also feel it's important to have a quiet, healing environment. So we try to really pay attention to the noise because we want our patients to be able to rest and recover. We also look at individual preferences, so if someone wants a particular diet or their door closed versus open, then we try to respect those individual requests made by patients and families. Just remember, our patients and families are trying to get through a stressful time in their lives. Your role is to do what you can to make them feel comfortable and to meet their emotional and physical needs.
From the moment I arrived at Northeast Rehab, everyone was wonderful. Of course, it was name and date of birth, and it was always name and date of birth for every type of medication and any type of procedure. But right from the get-go, somebody came in and we went over my game plan. I met with my case manager. Everyone was so involved. There were 2 doctors there, and they were so supportive. They worked well with the nurses, tweaking my schedule, adding to the physical therapy and adding occupational therapy as it was needed. And everybody communicated. And what was really good was behind my bed on the wall, there was a list of things that I could do and couldn't do, like non-weight bearing, and as I was able to get up and use a walker, I became, I was certified then to use the walker, and everything ran very smoothly right up until the time of discharge.
Information sharing begins with the patient and family upon their admission to one of the Northeast Rehab units. The nurse and the care team, which is comprised of the physicians, nurses, LNAs, therapists, and any other staff member that's on the unit, go into the room and we talk to the patient about their overall goals, what they can expect from rehab, what they can expect from their stay. We have an informational notebook as well as a flyer that we give to the patient and family. We review it with them. The whiteboard is a communication tool that we have in each patient room for the patient and family and our care team to be able to communicate different goals and plans of care. It can be updated on a daily basis, a weekly basis, as needed, as things change, as goals change. Everyone is responsible for putting up goals. Some of the key points that we identify on the whiteboard are we have orientation for the patient and family, we have the date and the time, we have the plan of care for the day, we have any services that are going to be provided during that day. We have the family and patient come up with goals of theirs that we incorporate on that whiteboard. Anything that's important for the family. If a patient isn't able to dial the phone on their own and they have a phone number of a loved one that they would like help with, we can put that on the whiteboard. So any staff member going in to answer a call light or assist the patient or do hourly rounding is able to see, oh, I need help to call my wife and this is her number. Anything specific that the patient would want or need help with can be communicated on that whiteboard. We also use it for an hourly rounding tool, and we keep the times of our hourly rounding checks on the bottom right of the whiteboard. So patient and family can see, oh yes, somebody just checked on me 45 minutes ago, and they can expect that another staff member will be coming in without them utilizing their call bell. Research shows that when you have good communication and good information sharing, that we truly have the best patient outcomes and recovery.
Patient family-centered care recognizes the vital roles families play in ensuring the health and well-being of family members. At Northeast Rehab, patients and families are encouraged to participate in decision-making at the level they choose. There are many opportunities to promote participation during a patient's stay. For example, daily therapies provide an opportunity for family members to join the patient, learn about rehab exercises and activity modifications that can continue to be used after discharge. Family members can sit in on medication education by nursing staff, so to help with administration as a patient discharges at home. Patients can choose his or her care partner who is considered a part of their healthcare team and are involved in patient education, the plan of care, and plan for discharge. Those closest to the patients have first-hand knowledge about their health, lifestyle, and what matters most to them, and what potential obstacles may occur during management of their health. Their participation is not only encouraged, but is a crucial part of the patient's recovery.
One of the biggest things that I've noticed about here that, and I work in healthcare, so I have an idea of how it should work and how it doesn't work. And one of the biggest things here is teamwork. Instead of feeling like you're being passed around or kicked around, you feel like you're actually part of the team. You're not just the ball. And that's pretty big for somebody who's been, yanked around and been from doctor to doctor and really just feeling sick and ill and really feeling almost like you don't have a lot of control over what's going on, and having that, sense of control and being young and being in a place where you don't feel like you're excluded or left aside. One of the things that has been so nice about being here, that the staff always looks like they're happy and really glad to be here and enjoy their job and always say hi when they walk in the room and knock on the door, make sure that it's okay to enter, which is really nice because it's a privacy. You're in your room, and by being in your room, you want it to be your space, and by respecting that space, it makes it a lot easier to just kind of cope with being out of home and out of your comfort zone. So it creates kind of your own safe space. My mom is a case manager, so she is also very in tune with how things are supposed to work and how they don't work. And one of the things we've noticed about here is that if you have a question, it's always answered. It's not tabled, it's not left aside, it's always responded to, and it could be 5 different people who respond to it. They might say the same thing every single time, but you always get an answer. And that's really important for someone who has a hard time getting an answer, because not everybody has a diagnosis or has something that they can pin their finger on, but by being respected and responded to for every single question, just lets you know that they care and that they want you to be informed and to be a part of your care and everything that's going on.
Collaboration between the patient, their family, and the healthcare team is so important. It happens throughout the patient's entire stay. During a patient's stay, various members of their team will exchange information on a daily basis about their patient. Team members are always available to answer questions and address concerns for the patient and their family members. We find that patients and families may have mixed feelings about their discharge from the hospital. Returning home has always been the goal, but leaving the hospital in the care of their nurses and therapists can bring anxiety to both the patient and their family members. To manage this transition, the entire healthcare team works with the patient and their family to establish a unique plan of care for discharge based on the patient's level of care and their individual needs. Input from each member of the team is critical. The nurse will review the medication plan with the patient and family to ensure they understand how to administer medications and the importance of proper management. Case management reviews the plan for discharge services, including follow-up appointments with their doctor or specialty physicians, and provides contact names and phone numbers. This plan may include continued exercises provided by their rehab therapist, or in some cases, a therapist or nurse may be scheduled to provide services to a patient in their home. This comprehensive written plan ensures that the patient has all pertinent information in one place for easy reference. Finally, the physician discusses the importance of follow-up appointments and informs the patient that a summary of their stay will be sent to their primary care physician. We encourage the patient and family to ask questions regarding the plan of care before discharge. Our commitment to patient family-centered care makes all the difference to our patients and their families.
Patient family-centered care is an empowerment of patients and families to be involved in their own care through an informed patient and family of their condition and their plan, and also a prepared team of physician, nursing, case management, therapist, even pharmacist. Patient family-centered care is not just about effective communication with patients. Effective communication with patients is a given. I go inside the room and I sit down and I talk to patient and I keep an eye contact. I explain the disease process and treatment plan, but also getting the patient and family involved in the decision-making process of their own care, of their own disease. Make sure they have an understanding of what they have, give them all the options, and have them be actually accountable also. There's 4 major concepts on patient family-centered care. The most important one, in my opinion, is respect and dignity, and that's for not only for patient but also for family. In any disease process, family and patients are the people that work the most. I see them for a brief time in the day, the nurse taking care of them in a brief time of the day, but patients and family spend 24-hour, 7 days a week, every day, until the medical problem resolves. So they need to be invested. They have to have a better understanding, and they have to participate in their own care. respect for them is to communicate well with them, explain in details what they have, what their options, and have them be part of that decision when you make a decision about their treatment options.